A middle-aged man consults his family doctor for repeated attacks of flu-like illness with fever, chills, nausea, headache, fatigue, muscle aches, joint pains, and lack of appetite, shortness of breath, and cough. He also mentions in passing of sweet or metallic taste in the mouth. He feels better over the weekends and when on vacation. His doctor orders several tests and makes a provisional diagnosis of viral influenza or malarial attacks. Only if he had taken occupational history of this patient, he could have arrived at a diagnosis of metal fume fever or Monday fever. This patient was an artisan whose work involved working with metals like iron, brass, and copper. Diagnosis of metal fume fever can be easily missed as the complaints are non-specific and resemble a number of other common illnesses. Effective history-taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history-taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. Artisans constitute an important portion of rural Indian people who are not engaged in farming activities. They constitute blacksmiths, carpenters, weavers, potters, farm implement and hand tool makers, metalware makers, jewelers, sculptors, handicraft makers, bangle makers, basket makers, and so on. Handloom weavers are an industry by themselves, and some professions or family trades have been handed down over generations. Characteristics of work. Artisans are divided into the following categories: the skilled master craftsman, the wage worker, the fully self-employed artisan, the part-time artisan. A rigid hierarchical division of labor exists between more and less skilled artisans in every craft. Method of work and operations involved. The vast majority of artisans operate in informal work. The problems faced by the artisans and craftspeople are mainly concerned with lack of formal skills, lack of formal training, less exposure to information and technology, absence of non-farmer-oriented rural policy, no marketing support, non-competitive products, unable to thrive in competition, application of traditional leftover technologies. Hazards to health and safety. There are several types of risks associated primarily with the nature of work. Working with dung or manure kilns, pottery firing. Working with compressed gases, propane, oxygen or acetylene. Working with silver or other metals. Soldering. Working with wood, bone, antler, horn, teeth. Working with lacquer, shellac, varnish. Using acrylic or plastic-based paints. Working with oil-based paints or solvents for paint or wood coatings. Using commercial clays, slips or mud. Working with natural and/or commercial dyes and mordants. Working with vinegar, tannin, nitric acid, other acids, bleach. Working with lye, lime, ammonia or other bases. Working with leather or animal skins. Working in homes, cramped spaces with poor lighting, insufficient ventilation and extremes of temperatures. Working with crouched, bent and stooping postures and repetitive movements. Working at heights. Health problems and disease patterns. Let us now review health hazards of the workers with their causative sources in the work and their manifestations. Respiratory conditions. 1. Rhinitis, asthma and bronchitis. Environment in workplaces of almost all artisans are responsible for respiratory manifestations. Airborne dust in woodwork shops, lack of ventilation in gold and silver carving and plating shops, crowded workshops are some examples. Dust levels should be as low as possible. Molds in sawdust and damp areas of the shop also contribute to breathing difficulties. A syndrome called sequiosis resembles pneumonia. It usually appears within a few hours after exposure, and symptoms are shortness of breath, bronchoconstriction, dry cough, chills, sweating, fever and malaise. Repeated episodes can cause permanent scarring of lung tissue. Exposure to redwood dust causes sequiosis. 2. Pneumonia. Exposure to toxic fumes such as hydrochloric and sulfuric acids, cyanide, lead, zinc, cadmium in silver and gold plating industries, carcinogens in wood. Toxic and neoplastic conditions. Lung cancer. Chromium fumes can lead to chromium ulcers and cancer. Chromium poisoning. Exposure to coloring and painting material. Use of natural dyes such as indigo instead of cobalt or chromium. Exposure to mercury and related poisoning is seen amongst engravers. Skin hazards. Allergic contact dermatitis results from exposure to certain woods, resins, alkaloids, tannins, acids, salts and gums. Synthetic adhesives such as urea formaldehyde and phenol formaldehyde are other irritants. Some woods like West Indian satinwood and mansonia are highly toxic and are likely to produce skin eruptions or blisters in most people on first contact. Other varieties of woods like cocobolo are sensitizers that may cause allergic dermatitis only after repeated exposure. Reactions may be more frequent in summer in people over 40 and after exposure to freshly cut wood. Wood extractives such as resins, alkaloids, tannins, acids, salts and gums. Liquid uncured epoxy resin and hardener will cause adverse reactions in more than 40% of all workers who come in contact with it. Synthetic adhesives such as urea formaldehyde and phenol formaldehyde resin also are skin irritants. Injuries, mechanical and thermal stress conditions. Burns. Gases and solvents used in painting and jewelry making are very inflammable. Volatile fumes and finely dispersed wood dust in woodworking shops can result in fires and explosions. Exposure to indoor glass furnaces with high temperatures, ovens and small burners, welding of colored glass to bangles, melting, shaping, reshaping and joining, glass blowing, welding and soldering of glass, exposure to dust during polishing of glass, application of chemicals for cleaning and polishing bangles. Metal fume fever is observed more among blacksmiths. Musculoskeletal disorders. Awkward positions, poorly designed tools, repetitive movements, inadequate lighting and stressful conditions lead to muscle and nerve injuries, pain in fingers, carpal tunnel syndrome, hand-arm vibration syndrome, skin abrasions of palms and fingers, swollen fingers and joints, neuralgia and arthritis, and permanent deformities in fingers. Repetitive strain injuries such as back injuries, carpal tunnel syndrome, tendinitis, bursitis, and tennis elbow are seen in ceramic potters, carpenters, carpet and hand loom weavers, embroiderers and basket makers. Other conditions. Poor lighting and working conditions in workplaces lead to eye irritation, gradual blindness among carpet and hand loom weavers, foreign bodies, corneal ulcers, opacities and blindness are frequently seen among sculptors, carpenters, potters and engravers. Carpet weavers and hand loom workers are also exposed to fine cotton and wool dust and thus to anthrax bacilli. Health problems of artisans working with brass. Statues, carvings and castings still continue to be made in the attractive copper alloys like bronze and brass. The methods used are still traditional ones, although the raw material today comes from modern mines and furnaces. Indian brassware articles are renowned the world over. Countless artisans work with many varieties of metals and alloys to make handicraft articles. As they have to process the raw materials with heat and chemicals, they face innumerable health hazards. General. Brass alloys in their usual solid form and under normal conditions do not present an inhalation, ingestion or contact health hazard or fire or explosion hazard. Operations such as welding, brazing, burning, grinding, cutting, heat treating, machining or similar operations may generate dusts, fumes and machine turnings that may create a health or fire or explosion hazard. Target organs. Respiratory system, kidney, liver, central nervous system, eyes and skin. High concentrations of dusts or fumes may cause irritation to the eyes. Inhalation of metal fumes or dusts generated during welding, burning, grinding or machining may cause irritations of the respiratory tract. Flu-like symptoms such as fever and chills may occur a few hours after excessive exposure. Dusts or fumes can cause irritation to the skin with itching. Dermatitis may occur. Copper and zinc. Inhalation, overexposure to copper or zinc oxide may cause metal fume fever characterized by fever and chills, that is, flu-like symptoms which appear 4 to 6 hours after exposure with no long-term effects. Effects of chronic exposure to material. Lead. Chronic exposures may cause lead poisoning that can affect the digestive system, nervous system, reproductive systems, muscles and joints. Lead and its inorganic compounds are categorized as possibly carcinogenic to humans. Tin. Inhalation overexposures may cause a benign pneumoconiosis called stenosis with few or no symptoms, which is reported not to be disabling. Brass alloys. First aid measures. Eyes. Flush eyes with plenty of water for at least 15 minutes, holding eyelids open. Seek medical attention if eye irritation persists. Skin. Maintain good personal hygiene. Wash affected area with mild soap and water. Seek medical attention if skin irritation persists. Inhalation. Remove the worker to fresh air. Check for clear airway, breathing, and presence of pulse. If necessary, administer CPR. Consult a physician immediately. Ingestion is rare in industry. Dust may irritate mouth and gastrointestinal tract. If ingested, medical attention is required promptly. Metal fume fever needs special attention as it is a common condition in metalwork artisans. Metal fume fever, also known as brass founders' ague, brass shakes, zinc shakes, galvy flu, metal dust fever, or Monday morning fever is an illness primarily caused by exposure to certain fumes. Workers breathe in fumes from chemicals such as zinc oxide or magnesium oxide, which are themselves created by heating or welding certain metals, particularly galvanized steel. Other common sources are silver, gold, platinum, chromium from stainless steel, nickel, arsenic, manganese, beryllium, cadmium, cobalt, copper, lead, selenium, and zinc. Welders are commonly exposed to the substances that cause metal fume fever from the base metal, plating, or filler. Brazing and soldering, a type of metal work in which only the filler is melted, can also cause metal poisoning from lead, zinc, copper, or cadmium in the filler metal. In extreme cases, cadmium can cause loss of consciousness within a matter of minutes. Prevention of occupational diseases and injuries. Exposure controls, particularly for brass alloys, are personal protective equipment. Dependent upon process being performed on material, each operation must be addressed for suitable equipment. Gloves. Wear gloves as required. Eyes. Safety glasses or goggles as required. No special requirement for clothing and footwear. Respirator. If concentrations exceed established limits, workers need to use particulate respirators when grinding or welding. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease, for example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage, for example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible. often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to ebook or printed version of BOHS for Informal Industry, Manual for Primary Care Providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, please don't forget to ask him the $1,000,000 question. What exactly is the nature of your work?